Dr. Lee, thank you for inviting us to Advanced Vein Care Center. There's a lot of competition in your area, but you seem to be standing out. And what I want to do is twofold. I want to find out, what does advanced care mean to you? At the same time, what does quality care mean to your practice? So with that, let's just get started and find out, what is the difference of your practice?
Well, I think when it comes to vein care, it's so easy to just brush it aside as being not an important pathology. And I think many people don't know exactly what's involved in taking care of people's vein diseases. And there are a lot of people with vein diseases.
It's what, it's like 20, 30 million in the country?
Up to 25% of people have this condition.
In our researches, those numbers are pretty accurate, and more stunning is just about 3% of the population is actually treated. I mean, I think there's an overall fear or lack of education because of the general public thinking that we're still doing vein stripping.
That's correct. There are a lot of people who won't get the treatment that they need because they're afraid of being referred to a surgeon or to someone who does vein stripping, and they end up with these step ladder kind of incisions on their legs and just weeks of just horrific pain. So a lot of people do stay away from doctors, or they don't mention that they have this condition. And as a result, there are many people who have significant, I mean not just a little bit, but significant pain and discomfort. There are people who can't stand at the end of the day. I mean, literally, they cannot stand because it's just so uncomfortable. There are people who wake up in the middle of the night with leg cramps. There are people who are diagnosed with restless leg syndrome and are given medications with this condition that can be treated in a very effective way, in a different way. There are many people who have venous insufficiency that are not well taken care of. The thing is that the full spectrum of treatments that we have now are pretty far advanced and requires a lot of different technologies. Whereas before, we expected to do a lot of these in the hospital under general anesthesia in the operating room. Now we expect to do this here in our office, and that's a very good thing because it's less time, less resource consumption, and a lot more convenient for the patients. However, it also means that the practice has to be equipped to handle that. I mean, essentially, we're effecting a result that used to be done in the hospital with minimal scars, with minimal invasiveness, and all of that takes a lot of coordination, a lot of resources, and a lot of guidelines and policies inside of practice so that we don't go astray.
Where's the industry at, and where do you see it going, and where do you add value at this point in time with your center?
When the technology of endovenous laser treatment came about, everybody was doing it, and it was pretty much unregulated. Now the industry is going towards quality and outcome-oriented standardization, and pretty much I think everyone has to show that they're as good as that they say that they are. And that's where I think our practice probably has an advantage, because we document all of our results, we monitor and we assess our quality of care. We really try to adhere to the best vein care practices. And there are others in the industry now that are talking about that now, and that's probably going to be a very necessary part of vein care in the future.
When I say quality care, what does this mean to you?
Quality is such a buzzword these days. I mean, to some people, quality means feel good. Quality means holding your hand, and all of those are important. But I'm in the business to fix things, and good quality care means that I figure out what's wrong and I fix it. And that's the very fundamental thing. That is the minimum that I have to do. And all those other things are important that get added to that, but quality starts with finding out what's wrong and fixing it the right way, the right thing.
You have your own center, very professionally put together. Let's talk about how you got to this point.
First of all, although I am focused on the clinical surgery, I also have another interest, a very strong interest in the system of clinical surgery. Also the administrative part of surgery. My background is I have a master's in public health with organizational behavior and healthcare policy. I have been a national fellow for the Kellogg Foundation to assess and evaluate hundreds of nonprofit organizations and their operational efficiency and their financial viability. I have done that in my past. I was a medical director for years when I was in academic surgery. I know how to put together a good program, a good clinical program. And that's what I've done here, is not only my clinical surgery, my background in clinical surgery, but also putting together a care system here that's outcomes-oriented, results-oriented, but also pretty efficient and streamlined with people that like to work here.
Yeah, let's talk about the people who like to work here. Give us the brief.
They are highly competent because I like the old GE approach of honest evaluation. And if someone gets hired in my practice and they are not able to deliver the kind of care and carry out their job the way that they should, we give them a feedback. And eventually they learn how to do it well, or they just find that it's the wrong fit. And we have honest discussion. And so over a course of time, we have a group of staff that are highly competent and highly focused, and they all share my philosophy about patients and how to take care of patients in a compassionate way. Because, I tell them at the end of the day, it's what we do for the patients, doing the right thing and doing it in a way that the patients feel that the patient's experience is good. So they all share that, and if they don't, it shows up in their behavior, and and we give them the feedback, and only the ones who have a good fit with this end up working here. And frankly, the core staff that we have here are terrific. They're all like me. So, you have to buy into the culture of this practice to be able to work here. So they're good. I think my patients, they all are very happy with our staff.
If you had a crystal ball and you could look into the next 3 to 4 years, where would you see your center?
I think this center has the potential of being the leading advocate for vein care, to take care of patients who have real significant venous insufficiency problems around here, or to be the leaders in the educational efforts throughout the region. I think we are positioned pretty well to meet the needs of the referring physicians in this regard.
Just to close, what would you think the difference of your center would be compared to other centers in your area?
I think the main difference in our center are twofold. One is my involvement with the other industry leaders who subscribe to the best vein care practices. I think that's what sets my center apart, because as I said, the industry is heading towards outcomes-based, quality assuring kind of vein care, and we not only practice that and espouse that, but we are communicating and partnering with other centers around the country to promote that as the main thrust of our field for the rest of the vein centers. We are part of the vein care practice effort in the industry. It all comes down to your personality, what you value as important, and what you like to laugh at. And our practice has a group of people who are fun, who are very, very competent, and they're just very good at what they do. But on the other hand, they're also a pretty fun group of people, and they're very astute. They know how to take care of business. Our staff, they have a lot of stuff going on in their lives, but at the end of the day, we know how to take care of our business.
So maybe that defines what a concierge approach is.
Yeah. You know, concierge approach is definitely what we do.
Dr. Lee, thank you for taking the time to meet with us and inviting us to Advanced Vein Care Center. It was a pleasure to meet with you, meet your staff, and we wish you all the luck in the world. Thank you so much.